Hey kiddos, this is your first edition of Cunningham Live. Since we're not going to be in the classroom, at least on Monday, and you guys still have a couple of things that we need to knock out for your state checklist and things that you might experience in clinical, I'm just going to kind of show them to you here and go over them. Let me get closer so you can see my beautiful porcelain skin. And then when you come in, you can ask questions. We can talk about it. I can show you the products in person, that kind of thing. So the first thing I'm going to go over, I guess, is stockings. So you guys kind of all have said you know what they are. Some people wear them just around, like we were talking. I think we were talking about nurses sometimes wear them because they're on their feet for 12 hours. Patients, for different reasons, may wear them. They may wear them for swelling, and they may wear them for compression to keep the blood moving, the veins, bringing the blood back from the feet so that it doesn't like pool down in there and create a blood clot. So you're going to see, probably may see in clinical, the stockings. So they're very tight. If they are not tight, then they're the wrong size. I mean, these things, this is the thing I hated the most in my career. Putting these things on is like fighting for your life because they're supposed to be that tight. And they are elastic, but they're like a tight elastic. So they should come off every day. They should not stay on 24/7. They need to come off at least a little bit during bathing, and then put back on. The stockings usually have a hole in the toe. This is on purpose so that you can check the toes to make sure that they're warm, they're not purple and cold. Because if that's the case, the stocking's too tight and the circulation is impaired. So they probably will have a hole in the toe. My little tip and trick that I always share with you is if you use powder on the legs as before you put these on, don't use lotion if they get these, because even though it's nice for their skin, it will kill you trying to put them on. So if you have baby powder or some other powder available and you can put it on the leg, or even sometimes we used to like shake it into the stocking, it will definitely help them slide on a little bit easier. So a lot of people wear these. You probably will see them in the hospital or in the clinical or in the hospital if you work in the hospital when you leave us. So those are those. They also come in a very sexy thigh-high version. These are not as common anymore, but they do come in a thigh-high version. They're elastic 3/4, and they have like a little they have regular elastic, like this kind of elastic, and then they have like just the stocking elastic, usually goes in the front, to just make sure that they fit different thighs, because we all have different thigh sizes. So those are elastic stockings. I guess we'll talk next about ostomies. So we've talked a little bit about ostomies. You guys know, as twisted as I am, I have a colostomy bag on my cart. So the patient could have different types of ostomies. The most common one you'll see is a colostomy. It's usually in the right lower quadrant. Left lower quadrant. No, it's low. Let's just put it. It's low on the abdomen. Sometimes the surgeon will ask the patient if they have a preference of where it goes based on what kind of clothes they wear, things like that. But it would be lower on the belly. So that is when the colon, the large intestine, has to be resected, usually for a tumor. And for medical reasons, they cannot put the two ends of the colon back together. The patient may have a colostomy made. So it's the colon, the top part of the colon from the surgery is brought to the skin, and a stoma is what they call is what's created. So they take the colon and almost like take the very end of it inside out, and they suture it so that it's a round. It usually looks like reddish, because it is the mucous membrane on the inside of the colon. That is, once it's healed, that is the way the person will eliminate their bowels or poop. The other end of the colon, the bottom part that's not being used, will be sutured closed, and nothing should come out of the rectum at that point in time. So these patients will have to wear a bag. You guys know the bag. The other type of stoma that you may see, a lot of people who may develop really bad Crohn's disease or different things like that may need to have a bag placed in their small intestine. And that usually is in the ileum of the small intestine. So those people would have a little bit higher of a bag. Again, depending on if the surgeon asked them where they want it. And that would be called an ileostomy. It also drains stool. It works exactly the same way. The difference that you'll see is that the stool that comes out of the ileum is always really loose and thin because it hasn't made its way through the digestive system far enough to become more solid. So these are usually very, very thin, almost like a real thin diarrhea. uh, Typically have not a great smell. Um, and yeah, I think they're usually like the drainage is like usually more on the yellow side than stools color. Okay. So the other thing you might encounter is a patient may have a urostomy, which urostomy, urine. Patients who have had bladder cancer and have to have their entire bladder removed will have a urostomy. Those patients have their ureters connected. They take a little piece of bowel and they create the stoma, and then they connect the ureters, the tubes that come down from the kidney, to the stoma, and that's where the urine comes out. So those people will also have a bag. It's just a different type of bag. So speaking of the bags, we have a couple different options. We have the most common option that we use is called the Tupperware. It's a two-piece system. So this piece is called the flange. This is the part that sticks to the patient. It has like what looks like a Tupperware seal on it. Oh, it's already open. And it has a little hole in it. So the newest ones, the newest versions of these are not meant to be cut. You can cut them, but what happens when you cut them is you never get an exact fit around the stoma. So there's always the chance that stool will get on the patient's skin. And we really don't want stool getting on their skin for the obvious reasons. So most of these now are pliable. So once you warm them up, you can actually just kind of work with them to get the proper size. Oh, this one actually might be an old style. It's not moving. Let's see what this one is. All right, well, I don't know what's going on here. But yeah, so most of them now can just be molded. This one might just be too cold and my hands are cold. But you just play with it a little bit. You check it against the stoma. You play with it a little bit to get it the proper size. It is moving. But once you have it the proper size for the stoma, you would place it on the patient. It is sticky. They do make adhesive if you feel like this is some patients, they just have problems with the flange sticking well to their skin. So they do make a skin safe paste. Also, we can use these little swabs called skin prep. We usually use them anyway because it leaves like a little coating on the skin that actually protects the skin a little bit. Plus, it makes sure that the skin is cleaned off enough that the flange will stick. So skin prep is very commonly used before you put the flange on. All right, so this is the two-piece. The flange goes on the person, and then this also has like a little snap. It will snap together just like a container, hopefully. I hope these two pieces are compatible. Usually there's only one size fits all for the pieces. So yeah, there we go. So it will snap on, which this makes it easy if you need to take care of the stoma or for emptying the bag. The bags all have an opening at the bottom. This one has like no closure on it. There's two kinds of closures on these. There is a snap closure that I'm going to show you, and then there's one that's attached. The bags, you don't need to throw them out every time, so you will need to clean them out periodically. So this one is really great because you can get better use out of it because you can take it off and you can clean it and etc. You may need to just clean the stoma with a soap and water washcloth or even just a water washcloth to make sure everything's nice and clean. Most stomas stay pretty clean, but sometimes there will be like a little stool that's kind of stuck on the stoma. So this one, there's a clip. So this clip is like a snappy open thing. Of course, this one's not gonna open. There we go. Okay. And so what you do is you kind of roll the bag up a little bit and then you put at least one time. It depends on the clamp, how much plastic it will go over. So you open the clamp, I'm just going to do it once to show you. You put the folded piece of plastic in it, and then you push it. I do not know why I'm struggling today. Probably because I miss you guys. There we go. Put the plastic in it, fold it over, and you just snap it shut. Just like anything that has a snap or a clasp, you make sure it's completely locked. And then this would be the opening. And then when you go to empty it, you just open it. Maybe open it. So when these things work like this and it's like attached to a patient, it's like really challenging. So why is it not opening? Well, anyway, you'd open this and empty the bag. We're just gonna leave that alone. Okay, this is a one-piece product here. So this product has the flange attached completely to the bag. It does not come apart. These have to be much more disposable because when the bags get yucky, it's really difficult to clean them. The other thing is they do make drops that you can put in the bag that are deodorizer drops. They kind of work depending on the patient, but it makes the patient feel better, I think, that they make sure that there's no odor coming from them. So the flange is exactly the same. You would cut or mold the flange. This one looks like a cuttable one, so it has size markings all around it. Same thing, you prep the skin, make sure everything's clean and dry, and you would just stick this on. Not only is this a one piece, this has the foldable thing. This is almost like a strong twist tie like you get on your bread, but like stronger. So same thing, this one you would fold it up a couple times, and then you take the twist tie things and you fold it over, and you have a nice secure bottom. And then same thing, you would just open it to empty it. A lot of times when you empty these, the end may kind of become soiled or yucky, so I always do have a washcloth around to just kind of clean the end of the bag before I close it again. And again, we're just going to fold that back up, and everything is nice and secure, and the patient has their bag. Again, this bag would need to be changed more often because it can't be taken apart. With these two-piece products, if this flange is nice and secure and we know the patient has good skin, sometimes we'll leave the flange a little bit longer and just change the bag out. And then what'll happen usually is the flange at some point will start to lift and it will need to be changed anyway. So two-piece, one piece. Now, this bag is a little bit different. This actually is a two-piece, but it comes in a one-piece. This is your ostomy bag. So if you notice here, the bottom is way different. It's like a spout similar to the catheter bags because this will hold urine. So this is the one where the patient had their bladder removed and has a stoma that actually secretes their urine. So the urine will go in here just like a catheter bag. And then there's a spout at the end where you can open it and empty it and then close it, just like the catheter bags. This isn't as common, but you may see it. This is usually people who have had bladder cancer and had to have their bladder removed. So those are just a quick overview of stomas and appliances or ostomies, bags, and supplies. And I'll keep these out so you guys can play with them when you come in. So that's stomas. Let us move on to heat and cold. So you can be responsible for applying heat and cold if it is prescribed for your patient. And that's something that is within your scope of practice as long as you're following the care plan and doing it per guidelines. Whenever you put heat or cold on a patient, it really should only stay on for 20 minutes, and it should be off for a minimum of 20 minutes before it's reapplied. Outpatient places, or even like in sports, you'll probably see these type of packs. These are the snappable ones. You hear the pop and you shake it. And this is the heat one, which actually I should be covered in these. That would be a good solution to my children's classroom. So you just shake it up and mix it up until it gets warm, and then you apply it. Usually, these are just applied directly to whatever it is or through clothes. Because it is an outpatient, they only stay warm or cold for so long. So that's the hot one. Here's a little cold pack. Same thing. Ooh, this one got cold right away. Like it's already freezing. You put this on, like this one's really cold. Again, it can only stay on 20 minutes because the way it's made, it can go directly on the skin. So again, these are like more, this one's getting more like that one. Usually used in an outpatient area, sports area, something like that. Like it could be, they could use these in the nurse's office, but it's probably way more expensive. Well, now it's more than using just ice bags. Speaking of ice bags, you're more likely to see those in the hospital. I thought I had one in the back, but I don't. So they're like kind of a long sleeve. They have a clip at the top that's very similar to this guy. So, oh, yeah, this one. So they'll have a clip on the top that either looks like this or like the twist eye thing, but it would be to secure the top of the ice bag. The ice bag kind of opens at the top to like a hole because it has like plastic or wire. So you can put it to the ice machine. You fill it up. Like I said, it's kind of a long sleeve. It's disposable, but it feels like plastic or it feels like fabric. You tie it up and then the patient can have it on them. Usually we like to put like a pillowcase or something around it so that it's not directly on the skin. So those you can use over and over for the same patient. And that's typically what you would see in an inpatient environment. And these are usually what you would see in an outpatient environment. In an inpatient environment for heat, usually they use what's called a K-pad setup. So a K-pad setup is this little machine. You fill it with water. Obviously, you have to plug it in. And then it has tubing. This one has really long tubing. It has tubing that will help the water flow to the pad. So the pad looks like this. Kind of looks like a heating pad. If you feel it, you can feel that it has like little places for the water to run in it, like little pathways. You have to connect the pad, obviously, to the unit. So connect it like that and snap it. Connect this one on my glasses on, connect this one like this and snap it. Snap it. There you go. So now it's securely on there. If you need to change it, take it off, put it on, what you'll see is on the tubing part, there are these big clamps that you can clamp to keep the water from running while you're making a change to this. There's also little clamps on the pad, so you can do the same thing. Because remember, if there's water on both sides, when you open it, you're probably going to get wet. So make sure the clamps are on if you're changing the pad. So once this is turned on, it goes to, I think, 100. This is in Celsius. This one goes to 107. They don't go any more than 115 because that's considered dangerous. So usually like between 105 and 110. This one's set at 107. You can't really change it because it's not. I think you can turn it down, but you can't turn it over because some of these will do heat and cold. It looks like this one might do heat and cold. So some of the units will do both heat and cold. But either way, it's a water system. So once this gets up to temperature, it will be warm. A lot of patients complain that it's not warm enough because they're used to using their heating pads at home. But this is what you get. You're not allowed to use a regular heating pad in any kind of facility. So again, you would put this in a pillowcase and apply it to wherever the patient needs it applied. They're not supposed to lay on it, but they lay on it anyway. You should never lay on heat, especially elderly people, because their temperature sensation is not the same as it used to be. And they do get, quite commonly, actually, elderly people get burns from their heating pad. They crank them up to high, they lay on them, their sensation isn't good, and they can get burned. So this is called a K-pad setup. This is usually what you'll see for heat and sometimes cold in the hospital or the nursing home. And again, there's also the ice pack sleeve that you would see in an inpatient setting. So we talked about TEDs or elastic stockings. We talked about ostomies and the different types and the different types of setups for them. We've talked about heat and cold. I think that's all I'm covering in this video. And if I forgot anything, I'll see you later.